it's such a critical partnership and relationship, not only between the registered nurse in the operating room and the surgical technologist. They're in the moment in the operating room, but all of this starts long before that patient ever rolls into the room. So all of this infection control process begins long before, when the instruments are being processed in central services.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now, it's time to roll back and start the first case.
On today's episode, we are going to be speaking with Ron Kruzel, Executive Director at ARC STSA, and we're going to be focused on surgical technologists and the part that they play related to infection prevention in the operating room. Melanie, I believe you've had a chance to meet Ron in person, and that's really what teed up his guest appearance on today's show.
Yeah, I did. We met at AORN. He actually reached out to me on LinkedIn and said that he had a booth and would I come stop by his booth and talk to him. And of course, I said yes. And that applies to anybody else. If I'm out at an event and you want to meet me, reach out to me. But he did. And so we connected. And he's very passionate about the role he has and the surgical tech role in the operating room and applying that to the season, knowing that we were going to be talking about infection prevention. The surgical tech's role is very important, and learning about everything that they learn in school, how they're trained, what they're taught, it helps you see how important they are at the sterile field, at the back table, working alongside our surgeons and assistants and residents. And they're a valuable part of our surgical team. And so really learning the role that they play in infection prevention is just very important for all of us. And I thought he would be the perfect person to talk to since he's part of the accrediting body for the surgical tech programs.
All right, don't go anywhere. We'll be right back shortly with Ron Kruzel.
I'm Melanie Perry.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to First Case.
We are speaking with Ron Kruzel, Executive Director at ARC STSA, and now we're going to be having a conversation during this season of infection prevention, but very specific to the surgical tech's role in the operating room related to all things IP, as we like to say. And Ron, I think you're pretty qualified to be able to talk about the surgical tech's role in infection prevention. Thanks so much for coming on the show.
I really appreciate the opportunity, Justin. Thank you for having me.
So Ron, why don't you tell us a little bit about ARC STSA and just your experience in the industry as we kind of set the table for the conversation today.
The ARC STSA, it stands for the Accreditation Review Council on Education and Surgical Technology and Surgical Assisting. So we're an accreditation committee that resides in a larger organization known as CAHEP, the Accreditation of Allied Health Education Programs. We accredit 400 surgical technology programs around the country. And those programs most recently transitioned to 2-year associate's degrees. They have a significant core curriculum document that they follow related to core competencies and surgical technology training. My background is I'm a surgical technologist by training. I worked for 25 plus years in the operating room, working in all specialty areas, including open hearts and organ procurement. Worked in a trauma center for many, many years. And since then, I've made this transition over to working with the accreditation of programs.
So, Ron, I didn't realize when we spoke prior to this episode that you had so many years of experience as a surgical tech. You've really seen a lot in your career, and I think that's really cool that you take all of that experience and pour it into the accreditation body and making sure that our surgical tech programs are turning out stellar surgical techs every year. I think that is really cool. Tell me though, because in this season, we are talking about we're just talking about infection prevention, and I'm trying to come at it from every possible angle. And surgical techs have a critical role in infection prevention. They're scrubbed in with the surgeons, with the assistants. They're right there holding those instruments at the back table. And surgical techs have to know a lot in order to really be able to do their job well. So in their surgical tech programs, what are they learning when they are enrolled in a program?
Wow, I'm so glad you asked me that. I did take the opportunity to look at some of our key documents, because as we get really, really busy, we kind of not necessarily avoid them, but lose track of them. So I have just recently looked through our most recent edition of our core curriculum for surgical technology. It's the 7th edition. We've had it since 1982. Various editions, but it's an exhaustive document. There are, just from a volume perspective, there's 300 plus pages of specific surgical technology training, not only aseptic technique, as we all are aware of it, and sterile procedures, sterile processing is incorporated in that. Surgical technologists have a base training in central processing and surgical instrumentation processing. They also have basic sciences. Amongst those basic sciences, they have a medical terminology, anatomy and physiology. But most importantly, they have coursework in microbiology and surgical pharmacology. Those courses really kind of hone in on the infection control process. Their curriculum content's extensive. They're very well versed in surgical aseptic technique and issues related to specific surgical infections. All of the main players, including some, are included in the curriculum document for surgical technologists.
It seems like definitely focusing on aseptic technique and learning that microbiology and all of that would be huge in your curriculum and really be foundational to making sure that they were doing their best to help prevent infection, correct?
Absolutely. As I said, the core curriculum document is pretty exhaustive. It's obviously grown over the years, and many things have transitioned out of the core curriculum over time to make room for some of the technological advances and infection control advances that we've all gotten used to over the years. There used to be an exhaustive history of surgery component, but a lot of that has had to take a second tier compared to the critical components of patient care that we're also focused on, and the importance of assuring that sterile field is maintained adequately. And oftentimes the surgical tech, at least in our industry, is referred to as, the eyes and the conscience of the OR. And it's their job to assure that sterile integrity is maintained and that the decreased opportunity for an infection doesn't take place. So yeah, I think it's a well-versed document. It's been in development. There's a 50-year history of accrediting education programs that follow this curriculum.
Wow. That's a lot of detail, and that's important, having that attention to detail and that much work going into making sure that people are being trained correctly. But it's not just coursework. It's not just going to school. Surgical techs are also getting a lot of clinical training and a lot of clinical time in the operating room. Can you talk a little bit about what goes into a surgical tech's training program when they're doing their clinicals?
Sure. And just to maybe take a step before that, a critical component of a surgical technologist training is actually a lab application process. So there's the theory. They learn about aseptic technique. They learn about sterile consciousness, sterile setup, and things such as that from a didactic perspective, a book perspective. And then they do that application in a lab setting in the classroom long before they ever get into the clinical setting. So surgical technologists enter into their clinical relationship, that partnership that our hospitals have with our programs. And they have a background in aseptic technique, and they're well versed to understand the components of sterility. But it's in the clinical area where it really is honed. And a main component of the clinical experience, obviously, is getting the case experience. And sterile technique just goes along with that and recognition of sterile practice.
I see a lot of hospitals around the country struggling to have enough surgical techs. They don't have enough people. And so they are grabbing LVNs or nurses, and they're just training them on the job to do the role of the surgical tech because they need scrubs. How does that training differ from the training that surgical techs are getting in their programs?
Well, with regard to nursing training in the operating room, my wife happens to be a registered nurse. She's a school nurse. And in her ADN program that she went through some years ago out in California, she did have a surgical rotation. She shadowed a patient through pre-op and then the operating room experience. She was able to observe the surgeries that took place and then follow the patient through PACU, et cetera, and things such as that. And that was the extent of her operating room experience. So I believe, again, even to this day, that the surgical technologist has the most comprehensive training related to aseptic technique, far more so than typical ADN nursing programs. And much of that training takes place on the job for registered nurses as they transition into the operating room. So you really need to characterize the experience and the education and the background the surgical technologist has as that guardian of the sterile field. They have by far the most experience and training in that area. And that's even including the surgeons who I think, as we all know, as professionals in the OR, come in with virtually zero experience dealing with sterile technique and the operative field. So, yeah, I think, and with regard to the shortage, yeah, you're right. There's a critical shortage, certainly in our communities right now. There's a lot of reaction in the communities trying to fill those spots in the operating room. Along with that surgical technology shortage, there's a critical nursing shortage. So they're robbing Peter to pay Paul, I guess, for lack of a better phrase, in order to fill those scrub slots with critical needs, the critically needed nurse in the circulating role. It's not necessarily an optimal answer for patient care.
I understand. And when we're experiencing a staffing crisis like we are, I don't think there is just one answer to fit every problem. And I know that many hospitals, especially the larger facilities, do have didactic programs for nurses that they bring into the OR, and they are trained to scrub. I was not fortunate enough to get to experience a training like that, but I did have a couple of fantastic scrub techs who were very patient with me, who let me scrub in with them when, we didn't have a lot going on. They taught me how to pass suture. They taught me how to drape. They taught me all these things. And if it wasn't for those scrub techs, I would not know how to scrub today. And so there is value in learning from others and passing that information on and learning what we can, but also recognizing the depth of education and training that our surgical techs actually are really getting in these programs and why it makes them so qualified to be the right person for the job scrubbed in. I think there's a lot of value there.
Did this come into more focus over the last several years just because there has been so much more attention given to infection prevention, or because this is such a critical role in the operating room, has it always been that way? What's the sort of the context to this?
I think that, as I said, that we have a 50-year history of accrediting education programs. So formalized education of surgical technologists is at least 50 years in the making. And over time, it's gotten more and more similar to nursing education. I mean, the nurse from 50 years ago isn't learning nearly the volume and the acuity of techniques and nursing practice that the contemporary nurse is doing. And none of us have an enviable job, I think, with regard to that. But in answer to your question, Justin, that's been a basic premise of surgical technology education from day one. The concept of sterility, aseptic technique, protecting the patient from the surgical site infection. It goes on and on and on. So I think it's been a long-term component of surgical technology education, and it's only expanded over the years with regard to that knowledge base. So they do come out, as I said, with an exhaustive background from a curriculum perspective in understanding the fundamentals of microbiology, sterile technique, the use of pharmaceuticals and intraoperative drugs to combat surgical site infections, not only the indications, but the contraindications. So they have a wonderful background with regard to what can be used with what and what shouldn't be. And so it's their job, in essence, to, just like the registered nurse is the primary advocate, a primary advocate for the patient in the operating room. A surgical technologist should take pride in and should be recognized to call out breaks in aseptic technique in the operating room. There shouldn't be any question if any team member does that. The onus of responsibility is on all of us in order to protect that surgical patient.
That is so true. And I wish that everybody fully grasped the concept that the responsibility is on every one of us. Any one of us can stop the line. Any one of us can say, this isn't right. This doesn't need to happen. And everybody should feel empowered to use their voice to protect the patient. And I think oftentimes people don't feel like they can, depending on the environment of the room or whatever's going on. They don't always feel like they can. But anytime it's for the benefit of the patient, anytime something's not right, they need to speak up.
It's such a critical partnership and relationship, not only between the registered nurse in the operating room and the surgical technologist. They're in the moment in the operating room, but all of this starts long before that patient ever rolls into the room. So all of this infection control process begins long before, when the instruments are being processed in central services and items are being wrapped and sterilized and run through appropriate cycles. So I can't emphasize enough, and I so agree with you, Melanie. We all need to empower each other for the best interest of the patient. Everything, every innovation, every policy, every standard that's been established for patient safety in the operating room has been developed by nursing and by surgical technology and cooperation at those various levels. The physicians come in and anticipate, they expect that the experts in all of these areas that we're talking about in infection control are the people that are standing there in the room with them. It's just so critical. I can't emphasize it enough. And the opportunity that we have, especially now with all of the challenges that we're facing as a community in patient care, how we can work better together to provide those services. So I agree with you. Empowering our professionals is critical.
You know, one of our previous podcast guests on a much earlier season, I don't want to say which season, but it was Amanda Heitman. I do remember that. She's an OR educator, and we were interviewing her the first time. We've interviewed her twice, but the first time we interviewed her, she made the comment that nurses and scrubs in the operating room are the OR professionals. We are there day in, day out. We know the guidelines. We know the rules. We know what's right. And our surgeons, yes, they come into the operating room, and yes, they come in to operate, but we are the professionals in the OR. We know aseptic technique. We know how to keep things sterile. We're the ones watching for those breaks in sterility. That's what we do. It's recognizing the important role that we have and using that to make sure that our patients have a positive surgical experience and that we help prevent infection by paying attention to all of these things is important.
Yeah, it's a partnership. I mean, there's no question in my mind between nursing and allied health professionals that serve in these capacities. And you know, one other observation, I guess, there's just so much technical components now to the operating room. As I said, nurses they know a lot more than just prepping the patient and monitoring and slapping the Bovie pad on. I mean, as I use the word Bovie inappropriately, I suppose I'm dating myself, but the point I'm trying to make is that the technological component, what a nurse needs to know to manage a patient's care in the operating room, is so much more substantive now than it was even 10 years ago. And similarly, at the sterile field, there is so much technology that is in place now that it's virtually impossible for one professional role to oversee all of that. That's why we have the division that we have. And it's not a division, it's a partnership. But there has to be people in these roles.
So here's a question I have for you, just as it relates to the fundamentals there that are the basis for everything that we do. At the same time, this technology is just taking right off and requires some specialization, right? It's kind of what you're saying in that collaboration. But then we'll have conversations about how hand washing is still the biggest challenge to infection prevention, and it's so basic to and so fundamental to everything that we do, and yet everything we're doing in surgery is becoming more advanced and more technological, and it's requiring higher levels of training and expertise and even a broader skill set than it might have 20, 30 years ago. What are some of the challenges that come into play, especially as you talk about reinforcing that education? Because I would think, and having had this challenge with hand washing, even when I thought about it during my day-to-day life, I'm like, yeah, this is something I might have practiced really well at the hospital, but maybe I wasn't paying as much attention at home because you just take it for granted. What are some of the challenges in re-educating and making sure that that fundamental nature is still getting as much attention as it did when somebody was brand new, even as, their focus is maybe being placed on more technologically advanced requirements of their training and their role?
Well, thankfully, the core curriculum for surgical technology still requires people to learn the stroke method of scrubbing and also the timed method count of scrubbing, 15 seconds on one aspect of your finger or whatever the case may be. So that's still fundamental curriculum. So that's really emphasized for surgical technology students. And then they enter into the operating room theater. And you're right. There's such a, I think we're all painfully aware of the rush of surgery, the effort to get patients in and out in a rapid perspective, trying to be as efficient and effective as possible. So things get sidestepped. And that's been going on, I think, in history in surgeries for as long as I've been involved, since the mid 70s. That being said, there are mechanisms that can maintain that emphasis. I think it's incumbent on all of the professionals in the operating room, the surgical technologists and nursing staff, to continue to emphasize the importance of these fundamental aspects. Very briefly, I work for a volunteer board of directors. We have professional educators and practitioners in our area that oversee our accreditation services, and I'm directly answerable to them in my role as executive director here. One of our directors has a program that she runs through her education program in Louisiana, where they go out hospital to hospital, where they bring actually secondaries, not high school age, but younger, like middle school age students in to tour operating rooms, and they emphasize the importance of hand scrubbing. And that's a big part of their program, not only for what they do and emphasizing what happens in the operating room, but they're teaching those kids the importance of doing it in their personal lives and doing it that way. We were all very diligent during the pandemic, and now I think we've all kind of fallen off the wagon again. It's just one of those things that we have to continue to emphasize.
Yeah, that was a great answer. And I'm gonna have one follow-up for you, which is, talking about these fundamentals and placing an emphasis on the technology and the training, and that being, I'm not going to say a distraction. It's not a distraction, but it just garners more attention. Might it actually be technology that helps us maintain these fundamentals ultimately, while at the same time currently it's technology that might be taking our attention away from the fundamentals?
I think we're in such a rush to apply technology that some of the fundamentals get pushed to the side. I was teaching in the surgical technology program for 12 years prior to me taking these roles and what I'm doing now. And I was still teaching scrub technique when items such as Avogard came on board and things such as that. And it was so foreign to me to think that you could replace a 3-minute hand scrub with wiping something on your hands and walking in the OR to save 3 minutes. And it was stunning to me. And again, I'm an old timer. I still struggle with that concept. And again, the data demonstrates that it's as effective, if not more, or whatever the case may be. So you're right. I think technology can be a positive step for us in affecting adequate patient care and the changes in the techniques that we use. I used to teach open hysterectomies. I used
we don't
to
do too many of those anymore.
No, they don't. No. I'd be lost in the OR now.
I think, you know what? They say it's like riding a bike, and I really do think it is. You don't forget. You will get right back up and do it again if you step back in the OR.
Well, all these years later, I still think I still remember how to scrub in gown and glove, and I think I probably could. Now, if I got to the table, I'm not so sure about what I do with all that stuff.
All the different instruments and things might be a little different, but
yeah. I miss it though. It's been such a huge part of my life for so many years. It's very important.
Ron, this has been a great discussion, and I love the fact that so much of this season has gone back to the fundamentals in the conversation, because I feel like just re-emphasizing those is the basis of infection prevention. And we can come at it from 1,000 different angles, but over and over in our schooling, early on in our training, and to your point, in a lot of cases, Melanie, this education happens in the operating room once you've gotten your first job. And there's some fundamentals there, but how you apply them, especially in a nursing program that's very broad and not necessarily targeted educationally to surgery, is extremely broad in that scenario. So Ron, I think, driving home those fundamentals and just how targeted a program for surgical techs really is to how it applies in the operating room is significantly beneficial, I think, for those new workers coming into the surgical environment. And so, I'd say, Ron, is there anything, like, as we were talking today, that you kind of feel like we might have missed or overlooked, and maybe it's just another one of those fundamentals that needs to be reemphasized and always reemphasized again? Is there anything you'd add before we wrap up?
My background is surgery, and I've spent my entire life in this profession, but I did do a brief effort to try to be a history teacher, and my bachelor's is in history, and I was going to try to teach and didn't end up doing that, ended up back in my career. But, I think when you talk about fundamentals, I think that, and I mentioned it earlier on in our conversation, that one of the things that we had to sacrifice out of our core curriculum for surgical technologists was the history of surgery. So it's a very limited, very high level overview of what happened, how we got to where we are today. And I think that's missing in everything that we do, not only in surgical technology education, but I think potentially, and again, I can't speak to nursing education. I have not had and been part of that. But I think that we need to know where we came from and how important those pioneers were to cement the fact that this really means something. And all of these techniques didn't just get thrown into a book by somebody, having pizza over a table or whatever the case may be. This is hundreds of years of practice and brilliant minds, both physician and nursing and technical people, that have contributed to all of these things that we do. And so I just think that's a critically important point that we really don't drive home. It's all about making sure that patient has a positive outcome. I think that we all know that and we all want that, but we have to have the background to understand why we're working in the way we're doing it.
Ron, great point. I mean, a lot of times people want to know the why, and the why is answered with the history.
I think
it really
so.
is. Yeah.
Great
job, Ron. Thanks for coming on the show.
We just didn't make this all up. You know what? There's a lot of people before us did this. Yeah. So, well, no, I really appreciate the opportunity. Thank you so much.
That was Ron Kruzel, Executive Director at ARC STSA, talking about the surgical tech's role in infection prevention today, Melanie. And I just thought, so many times we keep going back to the fundamentals, but I do love how targeted those fundamentals are related to infection prevention when you're talking about surgical technologists and the surgical tech programs that they're involved in when they go to school and get trained to then ultimately work in surgery.
Yeah, the fundamentals really don't change. What we're taught about aseptic technique and how we have been taught to keep our patients safe, that is basic information, and learning that and applying that is so important to the surgical environment. I also thought he brought up a really good point talking about the history of surgery. We don't get that information. We don't get taught that. And I've read a few books on it and been fascinated by where we've come from and, how we got to where we are now. And you really do take the lessons from the past, take the mistakes from the past, and instead of repeating them, learn from them and do better, and ultimately end up with better surgical outcomes, better patient experiences, and apply those to have a better operating room. So definitely, if you have time to read some books on the history of surgery, you will not be disappointed. It's fascinating, if not a little terrifying, but definitely worth it to know where we've come from.
Yeah, I think the history of surgery is interesting to just about everybody. It's just not always focused on. And I can tell you, I had the pleasure of touring a private collection, 2-story building at a surgeon's home in the town where I live a few years back. Actually, Hank Balch and I went, and there are instruments going way, way, way back in time. Now, we didn't handle them. They were all in very special cases, etc. But that was absolutely fascinating. And you're right. Over time, we lose sort of our bearings on this is why this happened and then this happened and then how that technology advances. And you don't necessarily have that historical perspective. It is incredibly interesting. So highly recommend books or hands-on museums, whatever you can do. If you've got that passion like Ron talked about, then you should fuel it. And that is one of those great ways to do so. So thank you to everybody for tuning in to this episode with Ron. On behalf of Melanie and myself, thank you so much for listening to this week's episode of First Case.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.